So, good evening, ladies and gentlemen, respected members of print and electronic media, distinguished guests, and their colleagues. It's a great pleasure and a great honor and privilege to welcome you all to this important press meet, where we gather to mark a significant step forward in specialized child health care. Today, along with us, Dr. Taral Nadda sir, presently working at SRCC Children Hospital and Jupiter Hospital in Thane, Mumbai. He is a national and international figure in the field of pediatric orthopedics. Along with us, Madam Neeta Suresh Doshi, by profession a chartered accountant, a social activist, managing trustee of Sadbhav Foundation, Mumbai, patron of Dipsika Foundation. She is involved in various social activities like women empowerment and education in rural and urban population of Maharashtra. And with us might be after some time, Dr. Sukalyan Dev will join. He is the pediatric orthopedic surgeon from Coras Hospital. My dear friends, we, the Coras Hospital, in collaboration with Sadbhav Foundation Mumbai and Muskan Charitable Trust Mumbai, Institute of Orthopedic Disorders and Dipsika Foundation, has organized a free screening and surgery camp for children with orthopedic conditions like cerebral palsy, foot deformities, pediatric hip disorders, osteogenesis imperfecta, xenovalgum and verum deformities, etc. From congenital deformities, limb differences to sports injuries and complex spinal issues. Using the latest medical advances, child-friendly facilities, and with a team of extremely experienced specialist doctors and physiotherapists. It's a dedicated and comprehensive program focused on the musculoskeletal health and mobility of children. This initiative is rooted in the understanding that children are not just small adults. They have unique orthopedic needs that require tailored care, early intervention, and above all, compassion. Every child deserves the chance to grow, move, and play without pain or limitations. This program is not just about treating bones and joints. It's about supporting families, guiding recovery, and helping children regain their confidence and quality of life. We also recognize the role of the media in raising awareness about such services, ensuring that families, especially in underserved areas, know that help is available and hope is real. Your presence today means a great deal to us, and we thank you for your continued partnership in spreading this message. We will now proceed with our main agenda, followed by question and answer sessions where we will be happy to address your questions and concerns. Thank you once again for being here. Together, let's make childhood stronger, safer, and healthier. Thank you so much.
I am Dr. Taral Nadda from Bombay, but I feel very much at home here at Guwahati because I am coming here for more than 7 to 8 years, and we have a number of patients who are pediatric patients with orthopedic problems and their families who have been like my group of people I know very closely. So a few things I want to tell the audience about is, first of all, people will ask what is a pediatric orthopedic surgeon. So the answer is that children have their own special things nowadays. They have their own TV channels. They have their own cartoon channels. They have their own shampoo and soaps. There are special clothes shop only for children. Then why should not they have their own orthopedic surgeon? This is not the only reason why children should have their own orthopedic surgeon. The reason is that the children and adults, there is big difference in the bones. The adults cannot grow in height, but children grow in height because they have a structure called growth plate. And hence children orthopedic problems are completely different from that in adult. Now I've been coming to Guwahati for last almost 10 years, and I've noticed that there are few issues which are very common over here. And one of the issue is known as cerebral palsy. Cerebral palsy is caused because of injury to the brain at the time of delivery. If child is premature, if mother is weak, if mother has increased blood pressure, poor nutrition, if the delivery is taking place not in a hospital, under these circumstances sometimes the child when he is being born does not get adequate oxygen. The brain does not get adequate oxygen, and the first organ to suffer is brain. And these children, where their area which controls the movements does not develop very well, these children cannot do activities at normal time. For example, child is supposed to do head holding at 3 months. The child is supposed to sit at 6 months. The child will start standing and walking at 1 year. The child will start talking at 2 years and be ready to become a very useful citizen. Now, children with cerebral palsy miss this milestone. A child with cerebral palsy will have a delayed milestones. Not only that, they develop tightness in their legs or hands, and because of that, they are not able to walk very well. As these children grow, what happens? Their bones grow in length, but their muscles which are tight don't grow in height, and because of that they develop contractures. Some of these children will walk on toes, some of them will have scissoring, some of them have knees which are bent, the hips which are deformed, and hence they need special treatment. These children also have a future. They have mind on their own. They want to go to school, they want to play cricket, the girls want to dance, and they want to do things like every other child. Are we here to give them equal opportunity? That's the question. Okay, with this whole focus in mind, what we really want to do is, for these special children, we want to provide world-class treatment right here at Guwahati, and also make it available not only to the families who can afford such treatment, but also to parents where money is a challenge. Okay, the child cannot choose whether the parent can afford the treatment or not. Hence, we should be providing treatment to everybody, and hence now you see the whole partnership which is arising over here. On one hand, we have a hospital which is willing to support treatment of such children who have either cerebral palsy or deformities or disabilities. On the other hand, you have professionals. Sukalyan, please join me. So me and Dr. Sukalyan, me from Bombay, and Dr. Sukalyan, who's been trained with us not only in Bombay, but he's been to the best institutions in USA and UK, and now he is back. Very important, he is back to Assam and Guwahati to provide services to all 7 sister states, the children from these states, when they need a pediatric orthopedic problem. So then you have two arms. And lastly, which is most important, is financial support and logistical support. So we have Ms. Neeta Doshi from Sadbhav Foundation and Deep Shika Foundation, where they will financially support surgeries of these children. Not only that, we understand that many of the patients come from far off, and when they come to Guwahati, they don't have a place to stay. So at the Deep Shika guest house, a free stay and food will be provided for these families, where they can stay for a week or 2 weeks or a month, when the treatment and physiotherapy is going on. So I feel that today is a very special day, and this is a very special step. That's why we have named this as Mission Walk. But Sukalan, I'm sure we are not going to limit our dreams to just walking. We want these children to walk. We want them to jump and run, attend school, and I definitely know that many of these children will become very successful individuals of tomorrow. They will become doctors, they will become lawyers, they will become chartered accountants, they will become teachers, they can become news anchors, and I'm sure that some of them will get into administration and political activism to work for other children who are suffering like them. So that's the aim and vision we have, and we just request wholehearted support from everybody to support this a small dream which we have, to be able to reach out to every child in the Northeast who has disability and make Northeast completely child disability free. That's the aim, vision. Thank you.
I am a layman as far as medical matters are concerned, but yes, maybe I have some connect with Assam. Once I visited as a child, And working with Deepsika in Mumbai, I have formed a bond with Assam. And since the past few years, I have known Dr. Taral Nagra and his work, and seeing what wonderful work he is doing, we decided to associate with him. And then this was a God-sent opportunity, working with him as well as with children in Assam. Deepsika already has it is that place where they're going to put up is Sishu Ashray Sthal. So that place itself is meant for children to stay during the recovery period. And we also have a guest house where the doctors also can use the facilities. So I talk on behalf of both Sadbhav Foundation as well as Deepsika Foundation, that it's been a pleasure to be associated with this mission walk in Guwahati.
বাৰ্তালাপ কৰোঁ আপোনাৰ লগতে ফাৰ্ষ্ট অফ অল আজি আমাৰ যিখিনি ফ্ৰী অফ কষ্ট মানে বিনামূলীয়া স্বাস্থ্য শিবিৰ প্লাছ আমাৰ অস্ত্ৰোপচাৰৰ দিন আজি হৈছে, সেইখিনি এটা যৌথ প্ৰয়াস। তাৰ মাজত কৰাছ প্ৰতীক্ষা হস্পিটেল এটা অগ্ৰণীয় ভূমিকা গ্ৰহণ কৰিছে, সেইখিনি ফেচিলিটি দি আছে, আমাৰ ডক্টৰ চিষ্টাৰ থকা অস্ত্ৰোপচাৰৰ সহযোগিতা সেইখিনি গোটেইখিনি আগবঢ়াই দিছে। প্লাছ আমাৰ দীপশিখা ফাউণ্ডেশ্যন, মুস্কান চেৰিটেবল ট্ৰাষ্ট, তাৰপিছত আমাৰ ইনষ্টিটিউট অফ পেডিয়াট্ৰিক অৰ্থ'পেডিক ডিজঅৰ্ডাৰ্ছ যিখিনি ছাৰ ডাইৰেক্টৰ হয় তাৰাল ছাৰ, চ' সেইখিনি চবেই মিলি আমি যিখিনি বস্তু আগবঢ়াইছোঁ সেইটো আহিছে আমাৰ বহুত দশকৰ এটা যিখিনি আপোনাৰ এটা গেপ আছিলে যে আমাৰ বিশেষভাৱে সক্ষম ল'ৰা ছোৱালীবোৰ ট্ৰিটমেণ্টৰ কাৰণে ক'ত যাব লাগে। চ' তেওঁলোকৰ যাবলৈ একো ঠাই নাছিলে, তেওঁলোকৰ ট্ৰিটমেণ্ট ভালকৈ হৈ থকা, এবাৰ ট্ৰিটমেণ্ট হৈ যায় কিন্তু তাৰপিছত যে ফ'ল' আপ কৰিব লাগে, তাৰপিছত যে দীৰ্ঘদিন যেতিয়া ট্ৰিটমেণ্ট চলি থাকে তেতিয়া অভিভাৱকৰ বাহিৰত যোৱা বা ট্ৰিটমেণ্টৰ যিখিনি খৰচা হয়, যিখিনি আমাৰ এক্সপেণ্ডিচাৰ হয়, সেইখিনি বহন কৰিবলৈ বহুত অসুবিধা হৈ যায়। চ' এই গোটেইখিনি কথা ভাবি আমি এটা স্থায়ী এটা সলিউশ্যন বিচাৰিছিলোঁ। চ' সেইকাৰণে আমাৰ এইখিনি অকল আজিৰ দিনটোতে আমি কাম কৰি আমাৰ কেম্প শেষ হৈ যাব এনেকুৱা নহয়, আমাৰ এইটো বস্তুটো ছাষ্টেইন থাকিব, দীৰ্ঘ সময় ধৰি চলি থাকিব। যেতিয়ালৈকে ল'ৰা ছোৱালী সুস্থ নহয় তেতিয়ালৈকে আমি আমাৰ চিকিৎসা আৰু আমাৰ আৰ্থিক সহায় আগবঢ়াই থাকিম। চ' যাতে একদম সৰুৰ পৰা নৱজাতক শিশুৰ পৰা ষ্টাৰ্ট কৰি আমাৰ একদম প্ৰাপ্তবয়স্ক হোৱালৈকে আমি যাতে তেওঁৰ ট্ৰিটমেণ্টৰ একেলগে সহায় থাকোঁ, একেলগে সংগী হ'ব পাৰোঁ।